our other headliners, who are really the true headliners. The following women are brave and they are beautiful. Their voices represent millions of others in the fight against breast cancer and healthcare disparities. We want to thank them all for joining. I'm actually going to pass over the mic to Diane Hyman, who is at MD Anderson Cooper, and has really been a nurse advocate in many ways and a community outreach advocate as well. So Diane, take it over.
Good evening, everyone. And Dr. Nguyen, just thank you again for that phenomenal presentation. And I'm so glad that it was recorded, for I know all of us are going to go back and listen to that again. And I want to thank you for reigniting me as well. Just really, I needed that. And so thank you for me to just continue to do what I need to do and help moving that needle the way we need to. And so without further ado, again, our main headliners are survivors on this evening. They're going to be speaking on equitable care from the eyes of breast cancer survivors. And the first I'd like to introduce is Miss Desiree Walker. She's a survivor extraordinaire, two-time breast cancer victor, health educator, cancer patient advocate, and a support group facilitator. We also have Miss Dominique Valentine. Dominique is a beautiful young lady. At the age of 27, was diagnosed with triple negative breast cancer. She is a resilient survivor since 2019. We have Miss Linda Gaddy. Linda is a woman of unshakable faith, was diagnosed last year during a pandemic, but through it all, she is still thriving. We also have Miss Lynn Morris. Lynn is turning her pain into purpose, and she founded Walk With You, a nonprofit organization for individuals and families that are affected with cancer. And we also have Miss Rakeisha Rourke, affectionately known as Kiki. Kiki listened to her body and insisted on getting screened, and today she is thankful that she did. And finally, we have Miss Chin Ryan. She accredits being an eternal optimist with helping her get through the tough times. And I present to you our panelists of survivors this evening, and we welcome them all to this valuable conversation. And the first, we'll hear from Miss Desiree Walker.
Good evening. Thank you to the organizers for the invitation, and thank you, Diane, for the introduction as well. I'd like to just start off by saying that it is a thrill for me to say that this year I'm actually celebrating my 20th cancerversary from my initial diagnosis. And I have to say that when I was diagnosed as a young woman, I wasn't sure that I would actually be here this long, because unfortunately, many of the people that I knew that were diagnosed with breast cancer didn't make it. And so I had no idea what this disease was. I often say, without embarrassment, I knew what breasts were, I knew the word cancer, but when you put it together, I was clueless. But I'm thankful for the knowledge that I have been able to acquire over the last 2 decades. And that I now use that information to go out into the community to help others to learn and to be able to be advocates for themselves. I'd like to say my journey has been an interesting one in that I didn't have any symptoms. I worked in corporate America. My employer offered on-site mammographies. I thought that it was a perk. I always felt that they worked me too hard. And so whatever advantages or perks I could take, I was definitely taking advantage of it. And one day I got a phone call after having a mammography telling me I needed to come back in for additional film. Now, I said that I worked on Wall Street, and it's a very hectic world. But when the woman said to me that she had an appointment the next day, it caused me to pause and realize that this was something that I needed to address sooner rather than later. And when I was there, the radiologist, said to me, you have calcifications, which are very common, But when they change in shape and size, it's a red flag and you need a biopsy. Well, fast forward, I said to him, I have no idea where to go to get a biopsy. And so can you help me? And he said he would have someone assist me in getting a biopsy scheduled. My biopsy was done. And the radiologist said to me, you know, we need to schedule you to come back in for the results. I said to her, I'd be all right if you just called me and tell me over the phone. I often say that may not work for everyone, but that was what I wanted and felt it would work best for me. And so in a few days, I got that phone call. I was at my office and I heard the words, "You have breast cancer." I paused because at that particular point, I knew nothing, as I said, about breast cancer. But I knew I'd better educate myself so that when I was going to build my healthcare team, I had a say in it. And I knew questions to ask, and I could be informed at the end of the day. So fast forward, they said, we caught it early. And so we're going to offer you a lumpectomy. Unfortunately, I had a lumpectomy, but I didn't have clear margins. And so I had to have a second lumpectomy. They also told me that I was positive for hormones. And so I would have to take hormone treatment. And I like to say that instantly from taking hormone treatment, I went into medically induced menopause and have been in it ever since. And so those of you who go into it naturally and have challenge, please know that as a young woman being diagnosed and going into menopause, it was not an easy journey. And so I took this as an opportunity to make lemonade with my lemons. And I said that I wanted to be a face so that the people in my community could understand that this is a disease that is real, and that being a young woman does not exempt you from hearing you have cancer. And so I've been doing outreach, you know, for the last 2 decades, just to make sure that people understand this is no joke. It's here, it's touching us, it's impacting us, and we have to be vigilant about our health. So fast forward, I did all the surveillance that has been instructed. The 5-year mark that I was told that I should look for as a milestone came. I was thankful. But then 8 years later, I woke up one morning and a voice said to me, check your breast. And I had had a mammography done 6 months prior. But when I called my surgeon and said to her, you know, I have this lump and I think I need to be seen, she said to me, come in. And everything just started moving real quickly in the sense that she saw me without an appointment. I then had a mammography without an appointment. She then said, you're going to get an ultrasound without an appointment. And then after that was read, I was told you need to have a biopsy and we're going to find a radiologist to do it today. So I had all of these services done in one day without an appointment. And I like to tell people, although I've been on this journey for a long time and I've been diagnosed twice, and for those of you that are believers, I do feel that I am blessed and highly favored as a result of being able to have that type of service quickly in New York City. And so fast forward, it was an aggressive cancer, and the journey was not an easy one thereafter. I did, in addition to mastectomy, I decided to do a bilateral. I had to do chemotherapy. I was now positive for HER2. And so I had Herceptin added to the mix. It has not been an easy journey, but I'm thankful to still be here. I'm thankful to be able to talk about it. And I appreciate the opportunity to share some aspects of my difficult journey, but know that I am grateful to still be alive. Thank you.
Thank you so much, Ms. Walker. We are going to introduce our next survivor, Ms. Dominique Valentine. She is a beautiful young warrior who was diagnosed with breast cancer at the age of 27, triple negative breast cancer. And she has shared her survivorship journey with us last year and then and agreed to come back this year. So we thank you, Ms. Valentine, are you on? We'll let you speak.
Hi, guys. Nice to see you all. I'm so happy to be among all you beautiful survivors. My name is Dominique Valentine. I was diagnosed with breast cancer at the age of 27, triple negative. I won't get into a lot of my story because I'll be sharing a lot of it Thursday night, but what I really want to focus on is my diagnosis and how it was discovered. July 2019, I randomly went to go get a breast exam. I was going into my third year of marriage, and I was just like, let me go, just make sure I'm okay. And I was, no lumps, no bumps, nothing. Everything was normal. Ironically, that next month in August, I felt a lump in my breast. And for me, 27 years old, entrepreneur, newly married, my mom had a history of cysts in her breast, my sister as well. I was like, okay, I need to get this checked out. But for me, it wasn't an urgency. I contacted my primary care doctor, and the appointment was a month away. So it wasn't until almost 30 days later that I was even able to get the lump looked at. I shared it with my primary care. She checked it out and she said, you're right. It's probably, just a cyst. You are young. I don't think this is, cancer, but I would like you to get it checked out. And I'm grateful that she did that for me because I hear a lot of stories of young women who go see their primary care and they say, we'll just keep an eye on it. We'll come back. We'll see what it looks like in 6 months. But I'm grateful that she did leave me with a referral to get a mammogram and an ultrasound. I left that day and I went in the parking lot to call my insurance, and I found out that I had a block on my insurance. So if you miss anywhere between 30 to 90 days of your insurance, like I didn't know, honestly, that you can be dropped or blocked. So it was like shocking to me. And I was really confused on how you can be paying $200, $300 a month for health insurance and you miss a couple months and now you can't even see what's happening to your body in a life-threatening situation. So at that point, I was Googling how much does a mammogram cost? Where can I get an ultrasound? And, not really having any knowledge about it. And I kept reaching out to people, and I messaged a girl on Facebook who I knew worked at a local clinic. And she gave me the information to the CEED program at MD Anderson. And I went through different things trying to see, if you qualify, things like that. Do you make too much? Do you make too less? Like the craziest things to get seen and get checked. But they said, you will get checked no matter what. We will make sure that somehow we get you screened, and they did. So I went from finding that lump in August to being diagnosed with breast cancer October 25th, 2019. So I'm sure that breast cancer that was probably stage 1 went to stage 3 over those 3 months and grown to 5 centimeters. So for that, it just brought up so much because I just can't imagine the average woman just like me who, may not have health care, may had a hold on theirs, might not even have had a primary care doctor at all, no history of anyone with breast cancer, being a young woman, not seeing anybody going through anything like this. Like, how afraid are they out there? Where's the information that's being shared with them about programs in their community that's available? So for me, it was just wanting to spread the word to people to just fight for themselves, fight for their health. And through my transition, I really learned how to be an advocate for myself early on, and taking my journey way beyond being breast cancer, but just living an overall healthier lifestyle, and sharing that through my social media and being able to inspire and help other women, because that was something that I was looking for when I was diagnosed. I didn't see anybody my age thriving and winning and showing what that looks like and how that this is not a death sentence and that you can still have a glorious purpose for your life. So I wanted to be that for other women. And that's how I've been living my life for the past 2 years now. And I just pray I get to live many, many more years with you all as well. Thank you.
Thank you, Ms. Valentine. You are a true advocate, and I call you, a warrior. You're so dynamic, and your story really can help others, your age know that, yes, first of all, if you feel something, go get it checked out. But really, you have to sometimes be your own advocate. And so thank you for sharing your story. Miss Linda Gaddy is a woman of unshakable faith. Yes, ma'am. Yes, you are. She was diagnosed last year with breast cancer during the pandemic, but through it all, she is still thriving. Miss Gaddy, if you could take a couple of minutes and share your story of your breast cancer diagnosis and anything that you think is pertinent for us to know.
Yes, good evening, everyone. And I'm really glad to be part of this glorious group of people. And this, as a new survivor, I was diagnosed for my birthday, 2020, April 23rd. Actually not diagnosed, but I took my mammogram at that time. And it ended up being something more for me to look into. And by May 28th, right at the height of the pandemic, excuse me, I was diagnosed with breast cancer. And I was in shock, honestly. I really thought that I was doing everything right in life. I was eat right. I worked out regularly, very athletic, and I was just in shock. But I was cool. I was like, okay, we can do this. We can get through this. And I was lucky to find a group of doctors and nurses and individuals who would tell me that I would be able to get through this. Well, it's been some journey. So far, I had the double mastectomy. I had chemotherapy, radiation treatment. I had ended up with chemotherapy neuropathy, where my feet and hands are still numb and tingly all the time. Wow. And then I ended up having a stroke, a heart attack, and COVID at the end of everything. But thanks to all of my care, my mentors, my friends, my family, everyone stood by me, gave me the energy to move on and encourage me. And I believe that along with God carrying me through it all, that all was important. And I said in the end, if I could be nothing more than inspiration to others, that's what I will do. So I'm really grateful to be here and grateful for the experience, even though it was such a tough journey, or has been such a tough journey. So thank you all for your testimonies. They encourage me as well.
Thank you, Ms. Gaddy. And, as someone who's been treated during the COVID pandemic, that part of what the health series is, or the breast health disparity series, is to address breast disparities during this era in COVID-19 and the challenges. There were a number of challenges I know that patients treated with breast cancer had to undergo. And we have to be thoughtful about that because, the pandemic isn't over. How can we better, support patients during this time? I'll come back to that question, but I do want to ask you that question at some point. Miss Lynn Morris is our next survivor. She is turning her purpose into pain. She founded Walk With You, a nonprofit organization for individuals and families that are affected with cancer. Thank you, Miss Morris. If you could share a little bit about your cancer journey.
Hello, and thanks for having me. I'm so encouraged just listening to everyone speak. I just want to say that in 2013, I was going to the doctor to just get a physical to actually do a mission trip. And they asked me when I left the doctors, they said, we need you to go get a mammogram. So I go to get a mammogram, feeling great, have no symptoms or anything. And once I went to get the mammogram, I went to the radiologist, and unfortunately, that wasn't the best experience that I had. When the radiologist asked me to come into the room, he began to just talk way above my head. And I don't even think he even said my name. It was a very uncomfortable thing. It made me feel afraid, or, those feelings that come on you when you don't know really suddenly something changed. So he didn't even ask me, do you understand what's going on? Are you okay? Or anything like that. So that was the unfortunate part. I do want to say that I went and did research to find a doctor. And when I did, I went to MD Anderson. And I want to say I think with the healthcare, especially with cancer or anything, that it's a partnership, I feel like, with the doctors and the patients, because Dr. Grana and the entire staff, all of them with MD Anderson, it really, really has been a good journey. Now, I was first diagnosed with stage 2, and I had to get surgery. I had to get radiation. I had to get chemo. And, you skin change, you lose your hair, all these type of things. Now, I wasn't always aware of all the resources that they had. So I think it's very important that that all the resources become more available for everyone to be able to access it. But since that time, they have changed things. So things definitely has gotten so much better. But in my experience, I didn't always have that. And then some of the programs that I went through challenges when the sense of when I had my nails had got dark, and you lose your eyebrows, your hair, and, you had to deal with your image and all of that. I went to a program, and they didn't have any makeup for a women of color. So that right there, I felt a little funny about that. And then I went in remission for a season of, I guess, about maybe 2 years or so. And then I found a little dot. So I went back to the doctor, and come to find out, it had spread to stage 4. It went from my breast to my liver, and then it went on my skin, like these big, large lesions, and they were oozing out. It was a terrible experience. And at least to say, I wore a lot of perfume during that time. So just to keep myself fresh, and big, large shirts and whatnot. Throughout this whole journey, I must say I had to stay positive. I had a wonderful support system. I always trusted in God through each time. I realized that it wasn't, to me, I felt it was not a death sentence. So I would do things intentionally to go forward and to live forward, you know what I mean, during the whole journey. But I will say that during the time where it had came back, that time it was more difficult because my body began to change differently. So I had to handle myself and watch myself and watch how I was doing it. But I must say that now, I had the chemo, the radiation, and all those different treatments. Now I'm on maintenance, and I feel so great. I don't even remember if they tell you to come back, those couple of weeks to check on yourself. I have to remind myself, because I'm always I'm going forth, and I just feel nice and strong. And I'm always trying to encourage someone else to go through it because of your mindset and different things that you have to go through. Now, I wouldn't want anyone to have this, but during this time for me, it's been, I guess, with the people that I allowed to surround me, it has been a good experience. And with this experience, I'm able to help others, but at the same time, it's helping me, it's helping me. And with my family, everybody has gotten stronger. It gave me more courage. I do things that I would have never done before. And I'm just actually enjoying life. Sometimes we go to work, we sleep, we get up, and we don't really enjoy life. I actually take the time to enjoy what I am doing every day. So that's basically what I want to say. today because I can go on and on, but I know time is going, but that's it. And thank you again for having me.
Thank you so much, Ms. Morris. The next survivor speaker is Ms. Rakisha Rook. She listened to her body and insisted on getting screened. Today, she is thankful she did. Thank you so much for joining. It's so good to see you. I'll share the screen with you.
Okay, can you guys hear me? Hi, so my name is Kiki, Rakisha, but I go by Kiki. So my story, I'm gonna try to keep it very brief. My story goes back to 2014. My aunt, my mother's sister, had breast cancer. Unfortunately, she found that in February. It spread through her whole body. She died in June. So I was 33 at the time, and I was scared. So I started getting mammograms. But then a doctor, I work at Cooper. So one of the doctors I worked for at the time was like, stop doing that. You put radiation in your body. So I stopped. So in 2018, I started getting this really sharp pain that went from my armpit to my right breast. I'm a little stalker, so I'm like, something's not right. I saw my PCP. I was already seeing a breast person at MD Anderson because I have really dense breasts. I saw her and I saw my GYN. All three of them checked me and they're like, no, it's nothing, it's nothing. So my PCP, I used to work for the Department of Family Medicine at that time. Dr. Robertson, he was like, it's nothing, but if you want to get a mammogram, I said, I want to get a mammogram. I said, because it's something's not right. I don't feel anything, but my body's telling me something's not right. On August 10th, on my daughter's birthday, I go get the mammogram. After I get the mammogram, the lady sits me down, a radiologist, really nice lady. And she's like, the way she's talking to me, I'm like, okay, she sees something. And she's like, does breast cancer run in your family? We saw calcifications. We saw this. I'm like, just get to the point because I'm scared. Like, I'm only 37. I need to know what's going on. So she was like, we have to do a biopsy. 4 days later, I got the biopsy. 2 days later at work at 9:30 on August 16th, I get a call saying I got breast cancer. I text Diane Hyman because I'm a stalker and I used to work at MD Anderson and I was able to get in and I actually saw Dr. Bing. She's the one that did my surgery. But I wound up getting a double mastectomy. We caught it early. I think it was like really small. I didn't need. No, I'm sorry. I just was basically just saying, listen to your bodies. I don't know if you guys heard that part because 3 doctors told me nothing was wrong with me and I'm crazy. And I said, the hell with you, something is wrong. So I am happy that I did go through that and I did get the mammogram. And then I found out because like I said, I probably wouldn't have got a mammogram until I'm 40 now. I probably would have just been getting my mammogram. And unfortunately, it'd have been 3 years too late.
And this is what I want to say. First of all, thank you for sharing your journey. And I would never will forget when we had our consultation and we talked about it even after your treatment. You were hitting the nail on the head that, you know, as physicians, and I'm talking to my physician community, physicians and providers, we have to be, we have to listen to patients, you know, and I know sometimes it's tough. I know sometimes we have patients who come in and we're like, you know, this is nothing. But I truly believe that we all know our bodies better than anybody else. And when you know, sometimes you just know. And for Black women, it is so important that they feel heard, for all women, okay? But I'm stopping here because this is not the first story like this, unfortunately, right? And so I just, you know, and to the general, you know, to the population, physicians do the best that they can, but going back to my physician colleagues, just listen to the patient. It doesn't hurt to say, you know what, let's get some imaging, or, you know, tell me a little bit more about that pain that you experience. Tell me a little bit more about your fears. and entertain that a bit. We know that disparities exist. We know that Black women are more likely to be diagnosed at a younger age compared to their white counterpart. And we also know that there are certain guidelines and recommendations that that I don't agree with, that many of my other breast cancer colleagues don't agree with, that, you know, starting imaging at a later age. We recommend at the age of 40. Or if you have high risk, earlier than that, but certainly always listen to your body, regardless of what age you are. Ms. Valentine was 27, so we have to just keep that at the forefront of our minds. Thank you again for sharing your story. And not last, but certainly not least, Missionary Ryan. She accredits being an eternal optimist, helping her get through the tough times, and that she is. Ms. Ryan was also treated during COVID-19, and so I'd like for her to share her story.
Hi, everybody. Okay, so I have to give Dominique kudos because I was stupid. My mother had breast cancer. She used to take me to screenings when I was a child. I hated them, and I got it in my brain that I'm not doing that. And then 12 years ago, I got Guillain-Barré, where I was paralyzed from the neck down. And after climbing out of that, it took 2 years to learn how to walk, use my hands, and do everything like that. I figured, what's God gonna really do more? Come on, I've been through the fire, you know? And then I went back to school, finished my master's, and I started teaching, and I felt a pain similar to Kiki. And I didn't associate breast cancer with pain at all. And I want to tell people that, like Dr. B said, just trust your body. And for some reason, I started feeling around it, and I felt this lump, and I was like, oh, no. You're not going to do this to me. Like, after everything I've been through, like, really? But I went for, I waited a week, and I told my husband, he was like, you have to go for a mammogram. You have to go for a mammogram. Went for the mammogram, and it was kind of a seedy place, like Lynn was saying. And I didn't feel comfortable, and it was in a doctor, and they were talking like in whispers. And I already knew I already felt it. I knew it was cancer. I just knew. As soon as I felt it, I was like, it's breast cancer. You know, had to mull over it a little bit before going for the mammogram because I knew what it was. And then I was working, and it was Breast Cancer Awareness Month at my college. And Dr. B was speaking. And one of my colleagues who I was telling, I got this pain in my breast and blah, blah, blah. She calls me up on the phone. She goes, you got to come up here. And I thought she wanted me to change places with her at the table. And she was like, no, you have to come up here. You have to listen to Dr. B. And I'm listening to her. And then she pushes me. She's like, go speak to her now. And I went up and I talked to Dr. B. And after I spoke to her, and somebody mentioned something about a team. I think, Linda, you mentioned that about a team, and Desiree also. When you have a team around you that surrounds you with this love, and Dr. Taiwu was there, Dr. Balian was here, I felt so surrounded by, it's going to be okay. Now, the journey became really difficult because of COVID. So it was really kind of like all over the place. And so I had a series of 3 operations because my body also didn't like the plastic of the bladder to recreate a new breast. So it just didn't like that. So it had to be taken out. And then I still needed the other breast off because I was looking at it like, you have to go away. I'm uneven right now. Can't. And so we did the other one, and it was, the operations themselves, it was kind of, and Dr. B, this has nothing to do with the hospital, it was COVID time. It felt like having an operation at the Mexican border because it was one of those kind of things where they threw you in the car as soon as you were done with the operation. There was no time to recover. You were kind of like groggy. And my husband pulled up with his car. They threw me in the back seat, and then I had home nurses, so it was interesting. But I got to be a champion of it. By the third one, I was up and out in like 15 or 20 minutes, I think. I think I missed Dr. B. She came down to look for me and I was already gone.
You're gone.
Went through 8 weeks of radiation, had Dr. Balian again, I was surrounded by beautiful Black female doctors. And it was such a pleasure to have that in my life, where nobody was talking above me, and my husband, of course, was at every single thing with me. Every single thing, he was there by my side. Because at a certain point, sometimes you really need a support system. And it's really, really important because at a certain point, your brain kind of turns off as to what's going on in your body and you can't listen anymore. It's just like, I don't know if I can really deal with all of the stuff that you're telling me. And I don't really understand everything. I understand it and I can read it, but it's my body. And you kind of shut down, and anybody who's doing it on their own, bravo. But at each step, take the time to breathe, collect yourself, and read through everything. Look at other stuff, read through stuff. Make sure you feel comfortable. And if there's a doctor that you do not feel comfortable with, it's time to go. So I mean, I guess that's all I have to.
That is, you dropped some wonderful pearls as always, Ms. Ryan. Thank you so much for sharing your journey. And I think, sort of as a segue, there are a couple of pearls that I'm going to just pull out from what you said, because you said a lot of good ones, that, it is important, and I can't stress this enough, particularly as we push for health equity and we push to eliminate the disparities, that, again, if you don't feel comfortable, if you feel like you're not being heard, I want to empower every patient that, and if I'm not the right person, let me help you find somebody. Let's just make sure we get this treatment going, okay? Let's just make sure that you are comfortable, because how you feel, how your psychological psychology feels, how you feel mentally, let me say that, can affect your healing process. And so, and I think we don't account for enough with Black women, the stresses and strains that we go through, the discrimination that that is experienced on a daily basis, how that impacts one's health. And Dr. Evelyn Rodriguez, who is on as well, she is the co-PI of the grant that sponsored this, the CME program. She and I are going to talk about what we've been able to do over the last year and a half, and what we've learned from focus groups and surveys that we've given Black women in the community. And it does point to discrimination affecting one's care. So that's one pearl. The second pearl is, I know that we have probably about 15 more minutes, 10 to 15 more minutes before we have to let you all go. But can you talk to us a little bit about inequality in your care, and if you have anything to share about your COVID journey? Those are really two different questions, but the COVID era and being treated, what could have been done better for patients moving forward. Ms. Ryan, you're absolutely right. It was a war zone in New York, and unfortunately that that was your experience, and I hate that was your experience. Glad that we got the surgery done despite COVID, but you're absolutely right. It was a war zone.
It wasn't a bad experience, though. I mean, I got the best care possible. I tell you, honestly, your team and having people meet me at the front, because my husband couldn't even walk me in. He couldn't be there when I woke up. It was one of those kind of things where it was, it was really kind of like we were we were in a war zone. We really were. It was kind of like triage.
Absolutely.
Like running in and running out, running in and running out. It's just like, and it was 3 separate operations of running in and running out. And I think that at the space that I had where you were, my reception and every care that I got was exceptional.
Lorraine.
And Lorraine, I have to say, Lorraine, I love her to death.
Is that your husband in the background?
Yes, that is him in the background.
I'm sorry.
Oh my God, I have to mute him.
It's okay. But our teams are excellent. And I think that's, that does speak to the patient care team and who we, choose to surround the patients that we treat. It's very important to be thoughtful about the patient care team. I'll let someone else sort of comment.
Yes, when it comes to listening to your body, I had to have a second surgery because I developed a hematoma on the breast that wasn't cancerous. And I was out of the surgery and I kept getting a fever. So it's like 5 days. I'm still getting a fever and they're trying to send me home. And I know because of COVID, they need to get me out of there. But it was 10 days later that I was okay or well enough to be able to go home after having that. I made all kinds of excuses. So they were looking at me weird, like, what does she mean she doesn't have a new bed yet? And so on and so on. I mean, I just knew that I needed to stay put and get better before I walk out of that door. And then when I actually contracted COVID, I had been out of the hospital for a while, but I couldn't go for my treatments. And it was really scary, and I was fortunate that I didn't have some of the major symptoms that came along with COVID, but what a frightening period of time. But at the same token, I had good care, like you're saying, Shaneri. I had good care and it made me brave enough, courageous enough to go through all of it. And thank you. Thank you so much.
So I think it's important to also talk about along the continuum of care from screening, right, to diagnosis, to treatment, to survivorship. There are opportunities to sort of address the inequalities that exist. And so I'm actually going to call on Desiree. Because I see she unmuted. allow her to jump in.
I appreciate that, Dr. B. One of the things that I would say is, as participating in this program last year, started me thinking about, looking back over my time. And, I realized that although I had gone to a cancer center, and so I thought that, I was going to get the best care there. As I listened to many of my fellow survivors, today, I realized that, and we know that there's clearly a shortage for people of color in healthcare. But I realized that the doctors that I had, even though they seemed nice and, did what they did, I realized that there was a bit of disconnect in terms of them not understanding who I was as a Black woman and what would be important to me as it related to my future. And I think, as I listen to some of the other individuals speaking, I'm saying to myself, wow, although you went to an academic center and you got good care, just because you didn't see anyone that looked like you, the experience is so different. And I think, for me, I'm always now trying to ensure that, people who are diagnosed, these days, they have the tools in order to be able to advocate, because many of us sometimes get intimidated by white coats and feel that we don't have the right to ask for what we want to ask for, or to even question what is told to us. And so it is so important, I think, to your earlier point, to say, doctors, listen more, and talk less at times, just so that you can make sure that you know that what you're proposing is going to be helpful to the patient. Because one of the things that I would say, in closing, is that oftentimes doctors think that you just want to be alive and that you don't necessarily want to live. And some of the treatment that you're prescribed does not take into account who you are and what you hope to get back to. And although we're not talking about mental health right now, I do believe that when you try to give people medication to keep them alive and they can't do anything for themselves, then we have mental health issues that exist. And then we don't even have services available for that.
Let me just jump in and say that speaks to what Dr. Nguyen was talking about, trust and trustworthiness, and how systems, and so at the same point, I want to encourage, physicians and non-physicians providers that, you do have the power to sort of check your biases and, work on building trust. It won't happen overnight, but work on building trust. If truly, you wish to be an ally, which I know many of my colleagues do wish to be an ally. They want to have a roadmap and understand. And so again, that's why we're doing this, the road to breast health equity, hearing the stories and going back and sort of in real life, changing your mindset and how you practice medicine may serve useful. Ms. Morris, did you have
yes, Dr. B, I was just going to say that when I had my first chemo treatment, it was so bad that I could not even get up to even work. I was so nauseated. I was so sick, so everything. And I talked with the doctor to find out, what they were giving me. And this is just in line with what it's saying. Like I said, Dr. Grinding, that team was just wonderful. They communicated with you, and she talked with me. And I asked her, is it something about this treatment? Is it too much for my body? Or what can we do? Because I can't function. And they did a change in the way they were doing it. And after that point, I worked the whole time. So I really do believe, like I said before, it's a partnership with your physicians, and where we can find a way to, communicate. And, I just wanted to just say that.
I think that's so great, Lynn, because it really brings up the fact that communication with your physician is such an integral part of making sure that you get care in the way that you want to receive it, right? Because it may not be the same for you as it is for everyone else. And that care and the way you want to receive it is important for your quality of life and for you to be happy with the care that you've gotten. So, that open communication is extremely important. And I think we haven't heard from Dominique, and I want to bring up, I think that everyone has brought up some wonderful points about what you think may be important for a future you or for someone else who's going through this to discuss. And Dominique, to bring you in, is there anything that you wish you had known in the past that you think may be helpful to others in the future?
Hi, thank you. Sometimes I get nervous about sharing because I do love my doctors, and I'm so grateful for the help that I had throughout my journey. But I did feel really pressure, whether that was created from myself and my beliefs, or whether that's just how I received it. I felt like everything was really rushed for me. It was all right, this is the diagnosis, you gotta start this. And I felt like if I didn't do it at that second, then I was gonna die. So as a 27-year-old, I wasn't knowledgeable at that moment to take the time, the information that I had to clear my mind, to think, is this the best thing that I see fit for my life? should I get a second opinion? Like all of these kind of things that you don't just think about when you hear that you have stage 3 breast cancer at 27 years old, triple negative, the most aggressive, bad rates for African American women. Like, so it kind of drives you into this fear mode. And when I was first diagnosed, I operated off fear and a lot of things with, just signing the line over to treatment. And I wish I just would have took a little bit more time to really think about things like I didn't even get like my eggs infertility. Like I didn't do any of that, and it was just because I operated off fear. And when I hear other people's stories and other people had time, it was like my period. I just missed that window that I could have had the treatment. So now it was like I either had to start chemo or I had to wait another month that it didn't look like I had time to do that. So I was like, okay, do I risk the chance of being able to have children one day? Or do I, jump into this and not wait a whole month before starting treatment? So a lot of that, was hard for a 27-year-old, 3-year married woman to process and to, figure out with my husband, like what we wanted to do. And a lot of it was operated off of fear. So I just wish that, and I tell to another woman to just take that opportunity when you get to the information and you take it home, because most likely you had this cancer living in you for a few months, if not years already, and you're not just going to die tomorrow. Like, so, just take what the doctors give you as information, because they're doing their job and handing that to you. That's what they're supposed to do. And now you're on your end, what you're supposed to do is take time and think, is this right for me? And I just wish that I took a little bit more time and did that.
Thank you, Dominique, for sharing that. I think that's an excellent point, right? That sometimes we wish we could have made a different choice if we had had the education or the time to make that choice. So thanks so much. I mean, you guys are definitely warriors. You're amazing women. You're courageous. It's not easy to come before a group of people and just discuss, stuff that's very intimate and sometimes very painful to discuss. So I applaud you. I thank you for making this evening really be such a triumph, thanks to your stories. And, we look forward, Dr. B and Dr. Hussein, we look forward to a lot of these in the future. We hope that we can continue these series, for years to come, and that you will be an enormous part of that future for us as well. So thank you.
Thank you so much.
I want to thank all of you guys. It's really very inspiring to hear everybody referring to the relationship between you and your treating physician as a partnership. I think it's something that I have learned, and I think I'm refining year after year, knowing that whenever I see a new patient, we always discuss cases in tumor boards with our colleagues and make recommendations that sound the best recommendations from our standpoint. But I think what I'm learning more is the goals are different from one patient to another. And that is where the role of advocates and patients who finish their treatment, helping new patients navigate this whole journey, is really extremely valuable. Thank you for doing what you're doing.
Thank you, ladies.